Chief Congressional Correspondent Nancy Cordes joins me now on the phone from Capitol Hill. Nancy, I think you asked the crucial question there, which is, has this new bill changed any minds? I know that there's a lot of substance that we should talk about when it comes to this bill, but the horse race does matter at this point. Besides Rand Paul, who do we know of is opposed to this new version?
Well, Paul and Susan Collins of Maine came out very quickly and said not only can they not vote for this new version, but they won't even vote to allow the bill to move to the floor to begin debate and begin the amendment process. And that means that if even one more Republican senator joins them and says that they will block the bill from going to the floor, that's it. This bill is just as dead as the first version. And so that's what we're all watching right now. You have a number of senators who were no's on the original bill who said to us today, I'm still reading it, I'm still thinking about it, I have concerns, but a lot of them want to wait, Stephanie, to see what the Congressional Budget Office has to say about this new version. And we know that the CBO score will probably come out early next week. So there's really no advantage to those senators to rush this and come out against their own party's bill when they can wait to see what the CBO has to say and then use that as a little bit of cover if they do in the end come out against it.
Right, and of course the CBO score on the previous version of this bill was that 22 million people would eventually not be part of the insurance system, would lose insurance. I guess the question would be, based on this new version, how much can they dig into that number? Let's talk about what's in it. Senator Paul there laid out some of what he doesn't like, but what else is different about this bill?
So the bill increases opioid funding. The original version was about $2 billion. The new version has $45 billion. It also does a little bit more to help stabilize the individual insurance markets. It sets up that fund that you heard Rand Paul talking about, which he describes as a bailout to the insurance companies to help stabilize premiums in the individual market. In order to pay for all that, however, the bill ends up keeping some of Obamacare's taxes. And so that's something that's deeply upsetting to conservatives like Rand Paul. And that's why a short time ago, when I ran into Mike Lee, a senator from Utah, who was a no on the first version, he said, he's still looking at this and he's trying to decide what he's going to do this time. The bigger problem, however, is that the bill does almost nothing to address the concerns that all of these moderates had about the deep cuts in the first version to Medicaid. It's really curious that the Senate Majority Leader, Mitch McConnell, who knows he needs their votes and he knows that they will not come on board unless there are big changes to the Medicaid cuts, really didn't tackle those cuts at all. And that has led some on Capitol Hill to surmise that perhaps he knows that he can never get the votes that he needs. And so if he's going to fail, he's going to fail with a more conservative bill than fail with a more moderate bill.
That's very interesting. This other piece, I'm trying to figure out how to read this, Nancy, which is that Senators Lindsey Graham and Bill Cassidy have unveiled details of their own alternative plan. What does that mean?
Right.
And what does it say?
It's kind of surprising because, when they dropped that this morning, there hadn't been any hint that they were really working on anything like that. We do know that Senator Cassidy and Senator Susan Collins of Maine had worked on something originally that was somewhat similar, basically allowing states to kind of decide whether they wanted to stick with Obamacare or not. The Graham-Cassidy bill sort of takes things a step further and says, all the taxes that we collect as part of Obamacare, what we're going to do is we're going to figure out a formula whereby that money gets divvied up and sent to the states, and then they can decide, do you want to use it and apply it to the Obamacare system, or do you want to apply it to your own system? So I guess states could, all have different health care insurance systems,
right.
which probably wouldn't make the insurance companies very happy. We haven't seen any sign that Republican senators are coalescing around that idea. Certainly the first iteration of this that was put together by Cassidy and Collins didn't get that much pickup from Republicans either. But, you never know. If this bill that was released by Republican leaders at the end of the day doesn't have enough votes, you're going to have a lot of Republican senators who are looking around for any way out of this mess, anything that the party can coalesce around, even if it's a smaller bill, even if it's just changes to the basic Obamacare system, so that they can go back home to their constituents and say, I did change Obamacare.
Right, and their constituents we've seen over and over again are really fired up, and they want to see some solutions to what's flawed about the ACA. Okay, so you mentioned that you're surmising, and others are surmising, that McConnell may have seen that this bill might be dead on arrival. When do we expect a vote?
Well, he just told us a short time ago it's still scheduled for next week. It has to take place after the CBO score comes out, and that's supposed to be early next week, probably Monday. And then the first vote would be just to move to the bill on the floor. And then you'd have a series of amendments that would come up from both sides. And this is really interesting, Stephanie, because if the bill does get to the floor, Republicans and Democrats alike can introduce amendments to change the bill. They could make big changes. Democrats, who are sort of more unified on this issue than Republicans, they could introduce amendments that strip out major provisions in the bill, or let's say they try to reinstate a lot of the Medicaid funding.
Right.
Well, you probably have a bunch of Republican moderates who would join them on that amendment, and they would be able to make the Republican plans start to look a lot more like Obamacare again. And then what happens? Do Republicans vote for that at the end of the day when they have to, cast a vote on final passages? So there's final passage. So there's still a number of twists and turns ahead.
Yeah. All right. Hold on to your hats. Nancy Cordes, you laid that out really well for us. Thank you so much.
You're so welcome.